you ready to be Proverbs 31 women? We don't want the Lord to see us sitting when he comes back. It's time to rise up. Rise up.
Shalom. I am Shoshana Tamar with Israel United in Christ, Memphis Camp. Today I want to take time to speak to you about the medical injustices against the tribes of Judah and Ephraim. Let's get started. Heart disease, stroke, high blood pressure, and diabetes are some of the leading causes of death and disability amongst Judah and Ephraim. Both these tribes have an increased tendency of being diagnosed with these medical conditions at a higher mortality rate than any other nation. Also, Judah and Ephraim are likely to experience more illness, minimal treatment, worse outcomes, and premature deaths. Whether it be a hospitalization or a routine visit to your healthcare provider, medical injustices are experienced on a day-to-day basis. Racism is a contributing factor to these medical disparities. However, lack of proper health insurance and unequal access to quality education affects the treatment process. Another point to consider is that by the time we are diagnosed, our bodies have lost the ability to compensate or adapt, and this is when we have noticeable symptoms. According to Deuteronomy 28, these circumstances are part of the curses that our people would be faced with from generation to generation. Due to poor eating habits, obesity, or a sedentary lifestyle amongst Judah and Ephraim, medication is often the first choice to treat high blood pressure, diabetes, and high cholesterol. It is very important to be compliant and work close with your medical care provider to develop a plan that works for you. We know that these medical injustices exist because of the hatred that the other nations have toward our people. We can't control their actions or their thoughts. However, we can control the choices that we make and how we subject our temples to these chronic conditions. Let's go over some tips on how we can prevent, manage, or alleviate high blood pressure, diabetes, and high cholesterol. Your eating habits. With diabetes, you want to make sure that you're eating green leafy vegetables such as spinach, kale. You want to be eating dried beans, legumes, flax seeds, broccoli, oatmeal, and much more healthy food selections. You also want to count your carbs. This is very important in controlling your blood sugar. When you're thirsty, you want to quench your thirst with water instead of soda. We know that sodas have a high content of sugar. We want to snack smart. Instead of eating junk foods, we want to snack on fruits, vegetables, or even nuts. Measure your meals using portion cups to monitor your food portions. We may be eating healthy, we may be eating right, but we're not measuring our portions, which can also affect our blood sugar. I've posted a link that will give you better selections on how to monitor your blood sugar with the foods you eat and your meal selections. High blood pressure. With high blood pressure, we want to be eating salmon and other fatty fish because this is rich in omega-3. Omega-3 is a mineral that helps control blood pressure and also other health conditions. You also can eat berries such as strawberries, blueberries, raspberries, pistachios, celery, tomatoes, broccoli, spinach, and other healthy food selections. You want to eat less meats and more plants. You want to reduce your salt in your food content, so it's best to cook fresh foods instead of prepackaged foods. Now, I know that some of us economically can't afford to buy the more healthy food selections. So if we have to buy the canned products, we want to make sure that we're rinsing the vegetables in the cans before we cook and prepare them. We also want to make sure we're buying foods that say low sodium if we have to choose the foods or vegetables that's in the can. You want to avoid eating in restaurants. However, If you do choose to eat in a restaurant, you want to be picking your meals off the portion of the menu that counts the calories for calorie control. And you want to cut back on sweets. I've also posted a link with better food selections to help you choose healthier meals to control your high blood pressure. High cholesterol. With high cholesterol, you want to be eating fruits and vegetables. You want to cook with herbs and spices. You want to eat avocados, olives, nuts, fatty fish that are rich in omega-3, and you also want to limit your salt intake. I've also included a link that will include foods that will help control your cholesterol level. Notice that some of these food selections are listed in all 3 chronic conditions. So if you have a mixture of 2 or 3, or if you're diabetic and have high cholesterol, or some people may have high cholesterol and have high blood pressure, you can choose the foods that are listed under each of those chronic conditions, and you can control both together by choosing those food selections that you can eat with both. Number 2, let's talk about limiting our alcohol intake. It is very important to make sure that you're eating a healthy meal prior to consuming alcohol. One of the effects that alcohol has is it causes you to urinate a lot. It has a diuretic effect, and as you urinate a lot, you're losing electrolytes. So you want to make sure that if you know you're going to be drinking a lot, or have a large consumption of alcohol in one setting, you want to drink water before you consume alcohol, during alcohol intake, and also you want to hydrate yourself after you drink. This helps eliminate the toxins the alcohol leaves behind. Also, you're losing electrolytes such as potassium and sodium, so you want to drink water such as mineral water, coconut water, to replace these electrolytes. Sometimes people may have a headache after drinking alcohol a lot from the night before, and sometimes the headache is caused by your sodium being too low. So it's very much advised that you hydrate yourself the day after as well. Number 3, exercise. You want to make sure that you're exercising at least 3 to 5 times a week, more of on the higher end, 4 to 5 times a week. You want to be doing it 20 minutes to 50-minute sections. Preferably the more minutes the better, but at least 20 minutes. This will help control these conditions because it will also facilitate weight loss. Number 4, you want to monitor your blood pressure. You want to take your blood pressure in the mornings, and you want to take your blood pressure in the evenings if you are at risk for high blood pressure, or if you actually have high blood pressure. This will help you catch any type of elevation in your blood pressure, and you will be able to track the cause that caused that change, and you can do what you need to adjust your diet, or work with your doctor to adjust your medication, or even if your blood pressure is getting lower and lower, you may even be able to be weaned off of some of your medication. So it's very important to check your blood pressure. Number 5, you want to check your blood sugar. If you're at risk for diabetes, which is called pre-diabetic, or if you have diabetes, it's very important that you know what your hemoglobin A1C number is. This number is an indicator that lets the doctor know how compliant you are and how chronic your diabetes is. So you want to make sure you're asking your doctor what that number is. And when you do your follow-up visit, you want to know that number so that you can compare both of them. And this will let you know if what you're doing to control your sugar is working for you. Number 6, you also want to be getting your cholesterol levels from your doctor. The LDL cholesterol is the bad cholesterol. So you want to make sure you get that number, and you want to make sure that you compare that number when you go back to the doctor with the new result, so that you will know that what you're doing is working to help lower your cholesterol. Now, sometimes the doctor may even put you on a cholesterol medication, although your cholesterol hasn't been affected. One of the reasons the doctors do this is because you may have other risk factors, such as obesity, or you may be non-compliant. So they do this to help prevent strokes and heart attack in some people that have diabetes and high blood pressure. Number 7, you want to adopt good coping mechanisms to control your stress, because stress can elevate your blood pressure, it can elevate your blood sugar, and it also can affect your cholesterol level. Also want to exercise to help control your stress. You want to meditate. I usually meditate on scriptures, or I may call one of the sisters and talk about how much fun we had on a high holy day. Sometimes you can listen to soft music and just meditate that way. So different things like that to help control your stress. Even getting counseling. Some things don't have to be chronic, or you don't want to wait too late to get counsel on certain things. So even getting counsel can relieve some of the stress that you may have. And last but not least, lose weight. And we want to make sure that if we're doing all these other things to help manage these health conditions, losing weight will only add to the benefits. You want to make sure that when you're trying to lose weight, you're losing weight in a moderate, effective way. What I mean by that is you want to set realistic goals. For instance, if I want to lose 40 pounds, I may lose the 40 pounds in 10 months, which is 4 pounds a month. So that would equal 1 pound a week. Or if I fluctuate during that month in losing the weight, as long as I am at 4 pounds a month in losing the weight, I could lose 40 pounds in 10 months. This is more realistic than setting short-term goals and losing weight. I pray that these tips will help you on your journey to a better lifestyle as you make more effective choices to improve your overall health. Thank you. Shalom. Most High in Christ bless.